Alopecia. Hair fall. What is hair fall? Its types, causes and treatment. Hair and hair follicle. Check the diagram for understanding. Hairs are keratinized elongated structures derived from invaginations of epidermis and project out from most of the body surface. Areas without hair: palms, soles, lips, nipples, labia minora and majora. Racial prevalence: whites are hairiest. Asians are least hairy and blacks fall in between. Types of hair morphologically: straight, Asians, whites; spiral, blacks, whites; helical, whites; wavy, whites; scalp, about 1,000,000 hairs; face, about 600 hairs cm2; rest of the body, about 60 hairs cm2. Functions of hairs: protects body surface from external injury, helps in sensory function. Psychosocial importance, forensic importance, identification of race, sex, age, and religion. Cause of death can be determined. Time of death can be determined. Assist thermoregulation, mainly in lower animals. Structure of hair and hair follicle: it is believed that each hair follicle goes through 10 to 20 hair cycle in a lifetime. There are 4 phases. 1. Anagen, growing phase. 2. Catagen, involuting phase. 3. Telogen, resting phase. 4. Exogen, hair shedding phase. Pigmentation of hair. Hair color is determined by melanocytes. Melanocytes are present in the bulb. Melanocytes feed melanosomes mainly to the medulla and cortex. Melanocytic follicles produce melanin. Eumelanin, dominant in brown-black hairs. Pheomelanin, dominant in red-blonde hairs. Graying of hair due to decreased number and activities of melanocytes. Vitiligo due to destruction of melanocytes. Albinism due to inactivity of melanocytes.